Witnesses, thank you very much for being here, and colleagues, thank you for all of your attention here. I just think it is so wrong for the Trump administration and Republicans in Congress to continue to try to rip affordable health coverage away from American families, especially our neighbors with pre-existing conditions. This lawsuit is just a continuation of their efforts to do that when they couldn't pass the bill here in the Congress, in the last Congress, despite Republican majorities. And I'm sorry to say that my home state of Florida, under Rick Scott's administration, joined that federal lawsuit. The 13 Democratic members of the Florida delegation have written to our new governor and attorney general asking, urging them to remove the state of Florida from the federal lawsuit that would kill the Affordable Care Act and rip health coverage away from American families, including individuals with pre-existing health conditions. This follows a letter we sent to Rick Scott as well. And I'd like to ask unanimous consent that these letters be admitted into the record of this hearing. American families they're simply tired of the assault on affordable health care. And Chairwoman Eshoo, you raised the point about the skimpy junk insurance plans, because one way that the Trump administration, Republicans are trying to undermine affordable care are these junk health plans that do not provide fundamental coverage. When you pay your hard-earned copayment and premiums, you should actually get a meaningful health insurance policy, not some skimpy plan that is just going to subject you to huge cost. These subpar and deceptive junk plans exclude coverage for pre-existing conditions. They discriminate based on age and health status and your gender. Consumers are tricked into buying these junk plans, mistakenly believing that they are the comprehensive ACA plan, but then they're faced with huge out-of-pocket costs. For example, in a recent Bloomberg article, Dawn Jones from Atlanta was enrolled in a short-term junk plan when she was diagnosed with breast cancer. Her insurer refused to pay for her cancer treatment, leaving her with a $400,000 bill. Another patient in Pennsylvania faced a $250,000 bill in unpaid medical bills because her junk short-term policy did not provide for prescription drug coverage and other basic services. The Trump administration now is actively promoting these junk plans, and I want American families and consumers across the country to be on alert. Don't buy into these false promises. Ms. Young, you've talked a little bit about this, but will you go deeper into this to help us educate families across the country? I understand that these plans often impose lifetime and annual limits. Is that correct?
It is, yes.
And that's something the Affordable Care Act outlawed.
Correct.
Can you describe what these plans typically look like and what kind of coverage they purport to provide?
Short-term limited duration insurance is not regulated at the federal level. None of the federal consumer protections apply. Some state law protections may apply or
Consumer
may not.
protections, name them.
The requirement that plans cover essential health benefits, the prohibition on annual and lifetime limits, the requirement that the insurance company impose a cap on the total copays and deductibles an individual can face over the year, requirements to cover preventive services, to not exclude coverage for pre-existing conditions and other.
Wait a minute. I've heard some of my Republican colleagues say they're all in favor of that. But can you be in favor of pre-existing condition protection on the one hand and then say, oh yeah, we believe these junk insurance plans are the answer, like the Trump administration and Republicans in Congress are promoting?
Short-term limited duration plans do not have to comply with the requirements about pre-existing conditions. That's correct.
Can you describe why an individual who is healthy when they sign up for one of these junk plans could still be subject to hundreds of thousands of dollars in medical bills?
There's no requirement that short-term plans cover any particular healthcare cost. So an individual who doesn't read the fine print behind their policy might discover, for example, that the plan only covers hospital stays of a few days and individuals are on the hook for all additional hospital expenses. They may find that the plan has a very low annual limit, so that once they've spent $10,000 or $20,000, they are responsible for bearing the full costs. or any variation like that where they simply discover when they need to access the healthcare system that the plan doesn't include the coverage that they had hoped to purchase.
Thank you very much. And we'll be working to ensure that consumers are protected, and when they pay their premiums and copays, they actually get a meaningful health insurance policy. Thank you, and I yield back.